Everyone, this is Edwin Jackson coming to you from Pulmonary POCUS, and we're going to be teaching the basic cardiac POCUS exam. Now, this is something that you should be able to do as a family medicine, internal medicine resident, general surgery resident, definitely pulmonary and critical care medicine fellow, etc. So it's important that we get down to basics because all of our other exams that we do really build off of the basic cardiac POCUS exam. So if you're coming to us from an emergency medicine background or radiology background, we want to start out by really looking at where the probe indicator is. So you can see I've circled the probe indicator there, and you'll notice that it is facing towards the patient's right shoulder. And you can see that we're making a sagittal cut through the heart here. You know, in radiology and emergency medicine, sometimes the probe indicator is in a different spot. You know, we really like it to be faced towards the right shoulder in a parasternal long axis view. This will help you kind of interpret images that you're looking at from the American Society of Echocardiography and other places, so that everything looks the same. So as you can see, the ultrasound beam is cutting through the heart. We'll get this in our normal view. So here we are in that orientation that we typically see. So I'll start out with some anatomy here, and then I'll give you some sonographer tips to kind of optimize your image. So if we take a look at this, you notice that our probe is at the top of the screen. And then as we're going down from the probe, the first structure that we run into is going to be our right ventricle and right ventricular outflow tract, which is here. Here we have our interventricular septum. As we go down, we have our left ventricle, and then we have the inferior wall of the left ventricle. Here's the left atrium. This is the aortic root, ascending aorta, left ventricular outflow tract. Now let's take a closer look at a couple of structures here that are very important for us. The first one is going to be the mitral valve. So mitral valve is here. And we have the anterior leaflet of the mitral valve, which is here. And the posterior leaflet, which is here. It's important to note that the anterior leaflet of the mitral valve is actually making up the bottom of our next structure, which is the left ventricular outflow tract. So notice as the anterior leaflet of the mitral valve opens, we see the left ventricular outflow tract here. And knowing that is going to be important for things like systolic anterior motion and hypertrophic obstructive cardiomyopathy, or even dynamic left ventricular outflow tract obstruction. So oftentimes, you find it surprising that when we talk about systolic anterior motion, the anterior motion during systole is actually the anterior motion of the mitral valve going into the left ventricular outflow tract. So we'll get the image started here again. Going from the left ventricular outflow tract, we see that blood is going to flow through into the aorta through the aortic valve. So we have two cusps that we can see here. We note that the aortic valve is trileaflet, but in this view we can see two of the valve leaflets. The first one is typically the non-coronary cusp, which is here, and the second one is the right coronary cusp. Now this makes sense that this is the right coronary cusp because this is our right ventricle. Okay, so just understanding anatomy is very helpful for you. Something that this idealized augmented reality view does not show you is a few other structures here, and I will draw those in. So typically we're going to have a little circle here, and in some cases a little circle here. This circle is going to be your descending aorta, and this circle, when you can see it, is typically your coronary sinus. And we'll go over when these structures are more prominent or when there are fluid pockets on either side of these structures and what that means. So a couple quick sonographer tips here for you all. Number one, you always want to make sure that the apex of the heart is on the left-hand side of the screen. And in this view, you often shouldn't be able to see the apex, but we'll highlight where it should be. It's right here. You'll want to make sure the LV walls are positioned perpendicular to the ultrasound beam. A real big one here that'll help your imaging quite a bit is you want this intraventricular septum to be almost contiguous with the aortic root. That's going to get you lined up properly. You want the LV to be horizontal. Okay, you don't want it to be vertical. And lastly, you don't want to be able to see any papillary muscles. Okay, if you're seeing papillary muscles, you're a little bit off axis. All right, so that's our first view, peristernal long axis view. I encourage you to try this out. Watch this video a couple of times, and we have a few actual images and clips of real peristernal long axis views. And happy scanning.